Welcome back. News 4 Utah continues following our commitment to keep you up to date on options surrounding the opioid epidemic. So are there viable alternatives to opioids?
Well, people we've talked to say yes, and one of those options is hypnotherapy. News 4 Utah's Saray Chin has more in tonight's In Focus report.
Hypnosis might be easy to dismiss, but we talk with patients who suffer from chronic pain, opioid dependency, and insomnia. They all felt relief from those ailments by using mind over matter. You see it in the movies, but is it hocus pocus?
It's not a stage show like you see or in movies. It's a wonderful process of deep relaxation.
Eyes are heavy.
Jolene Shields is a certified medical hypnotherapist in Mill Creek.
And those drops begin to trickle.
She's putting 62-year-old Sharon Parks under hypnosis.
Hypnosis actually goes into a very deep level of the subconscious where we give an image or a suggestion to the subconscious to create a change within the body.
Several ruptured discs left Sharon with chronic pain and daily migraines.
It was living from pain med to pain med.
Before hypnotherapy, life for Sharon was grim.
I didn't feel like I had a life.
Here's the magic. Under deep relaxation, the brain releases endorphin and serotonin, which are 200 times stronger than morphine that you get by IV in the hospital.
Music, calm, and focus. Jolene says people tell her they feel euphoric.
The very best high that they've ever had. I've seen the success.
Margaret Rasmussen is one of those success stories. She's suffered from insomnia for decades.
When I'd go to bed at night, my brain would just go into high gear.
Those sleepless nights, along with chronic pain and being her husband's caretaker, put her stress at an all-time high. But after 2 treatments, she was sleeping 8 hours a night.
Oh, that felt so good.
She believes it cured her insomnia. Tricks and trances. For many, hypnotherapy is serious science. Some believe it can hold the power over pain.
It's like your whole body just lets go.
Hypnosis is a very strong piece of any addict's program to really help them to have a new coping skill.
It's what got Jolene through her own bout with addiction years ago. A car crash left her with nerve damage.
I was absolutely convinced. Yes, it transformed my life.
And now she's transforming the lives of her patients through the very method that got her through the pain. Both Sharon and Margaret listen to their recorded session with Jolene twice a day.
Getting that endorphin release twice a day, which calms the central nervous system.
A study out of Whittier College shows adding hypnotherapy roughly doubled the chance of success for long-term recovery from addiction.
I had no pain whatsoever for the first time in 7 years.
It was just kind of an answer to insomnia.
And her prayers.
It's a natural process.
So what's holding people back? Insurance doesn't cover hypnotherapy, but flex spending can help pay for the costs. Every day, Jolene spends time talking with medical experts about the benefits of her therapy.
It's absolutely changed my life. I do think it's part of the answer.
If you are thinking about hypnotherapy, make sure you go to someone who's qualified. Jolene says her therapy should be used to supplement withdrawal treatment while the patient is being looked after by a doctor. I'm Saray Chin, News 4 Utah.